Sorry about that, folks. Hello, everybody. This is Mr. Sage again. I'm recording a pre-recorded lecture for the time that I will not be doing live lectures. It's chapter 22, the heart. So please get those lecture notes out and we'll go ahead and get started. Okay, we're in the cardiovascular system. We're talking about the heart. This is a good image showing you the blood vessels, the veins, and coronary sinus of the heart. So let's keep going. Okay, where's the heart located? Well, unlike what we traditionally think of as over our left chest, it's actually in the center of our chest, slightly leaning left at the apex, which is pointed downward. Interesting thing about anatomy, for a lot of the things that are called the apex, for example, apex of the heart, are pointing downward. Apex of our nose is pointing downward. Apex of our heart is pointing downward. The heart is located in the mediastinum, which is an area from the sternum to the vertebral column between the lungs. You can see that in that image there. Okay, what is the orientation of the heart? The heart has two main surfaces, anterior and inferior, and two borders, right and left. And you can see the heart there in that image, inside the pericardium, between the two lungs. The apex is directed anteriorly, inferiorly, and to the left. And that's why we tend to think of the heart as being on the left side, even though it's more or less in the center, with only apex pointing leftward and downward. The base is on the opposite. That's at the top of the heart. That's where you see all the blood vessels here coming out of the top of the heart. It's called the base. Okay, the pericardium surrounds the heart. It's a layer of connective tissue, protects the heart from rubbing up against the ribs, especially, and the sternum. It's a dual layer membrane containing fluid. The fact there's fluid between these layers gives friction reduction. It prevents the heart from damage when beating. The surface of the sternum is rough. So you want to make sure that the heart doesn't get shredded from the inside of the sternum. And so having the pericardium there protects it. It's made up of two layers. The visceral layer, as we've seen before, is always covering the heart muscle itself. Remember, when we have layers of connective tissue around organs, the visceral layer covers the organ, and the parietal layer then lines the inside of the cavity in which it sits. That's called the parietal layer. It's the outermost layer. It touches the lungs, sternum, and other surrounding organs. Okay, this is an image showing you kind of how you might imagine how the heart would sit inside of the pericardium if it were a balloon full of liquid. And in this image, you can see how it sits there. Okay, the layers of the heart wall. So if you were to cut open the heart, what layers of muscle tissue and other tissue would you find in the wall of the heart? The epicardium is the outermost layer of the heart, and that is the visceral layer of the serous pericardium, as I showed you in the last slide. The myocardium, myo means muscle, cardium refers to the heart, so it's the cardiac muscle layer that makes up the bulk of the heart. The endocardium, you can see here in lighter color, is the chamber lining and makes up the valves of the heart. So that's the innermost layer. Key to the endocardium, it should be very smooth to reduce damage to the red blood cells and friction between the blood and the inside of the heart. Okay, these are some great structures that you should know. This is a good image of the heart, and these are some structures that may come up in visible body. This is what a cadaver heart looks like with some of the same structures, and the posterior view of the heart, showing primarily the base. Okay, this is a diagram of the posterior view showing primarily the base. Notice that the pulmonary veins here are shown as red, while the pulmonary artery is shown as blue. In these images that you're going to see, pulmonary has the opposite effect of the rest of the blood vessels. So the colors are switched. Now let me explain what I mean by that. Normally, superior vena cava and most of the veins of the body are carrying deoxygenated blood and are indicated that way as blue. The aorta and most arteries are oxygenated, indicated red. But since the pulmonary system does the opposite of the rest of the blood vessels. They're going to be color-coded differently. So for example, the pulmonary artery is taking deoxygenated blood from the right side of the heart and moving it to the lungs, and then bringing oxygenated blood back through the pulmonary veins. Now, please note, veins always bring blood back to the heart, and all arteries always take blood away from the heart. But in the case of the pulmonary system, the colors and oxygen levels are going to be reversed, and that's why you see it that way. Here, the coronary sinus is named a sinus because it's a large empty cavity, and all the blue and red here are normal arteries and veins. Arteries carrying oxygenated blood, veins carrying deoxygenated blood. Now, please note, the only way that the heart receives oxygen is from these vessels penetrating from the outside. The heart receives no oxygen from the blood that's in the chambers at that time. It has to exit the heart and then come back around from the outside to feed the heart muscle. Okay, this is an interior view showing the chambers and valves. These two valves here are called atrioventricular valves, and these two valves here and here are called semilunar valves, named that because they look like half moons. And you can see with these AV valves, they have chordae tendineae, which are the cords that attach the valve to the papillary muscles, which are muscles that pull on the valve to keep it from everting or going the wrong way. And this is, again, a cadaver heart. Okay, let's start at the right atrium, a good place to start. Remember, in any circuit, which your blood is, you can start at any point, end at any point, but the right atrium is a traditional spot to start when we talk about the movement of blood through the heart and the circulatory system. So the right atrium receives blood from three different sources: superior vena cava, which is up here, inferior vena cava, which is down here, and the coronary sinus, which is emptying right into here. So that's where the deoxygenated blood is coming back to the heart into the right atrium. The interatrial septum, which you can't really see very well, but it is shown in this area right here, this blue area here, it partitions the atria after we're born. The fossa ovalis, which you see up here, this large oval here, is the remnant of the fetal foramen ovale. Now, what does that mean? It means that when we were fetuses inside of our mother's womb, this fossa ovalis was actually open, allowing left and right sides to mix. Now, why is that significant? Because you don't want any blood going to the lungs when you're inside your mother's womb, because you're not breathing oxygen. Instead, you want all the blood to leave the heart and go out to the placenta. And so by bypassing the right side here and going over to the left side only, all the blood then goes out to the umbilical cord and the placenta and gets oxygen from the mother's womb. Tricuspid valve. One of the ways to remember where that is tricuspid has the letter R in it, and that's on the right side. So tricuspid R, right. Blood flows through into the right ventricle, so from this blue area into this red area. And please note, since this is kind of reddish, that does not mean it's oxygenated. It's just indicating slightly different color based on the fact that it's a ventricle. It has three cusps, hence the name tricuspid, composed of dense connective tissue covered by endocardial tissue. Okay, now we're into the right ventricle. Its main job is to pump blood, deoxygenated blood, from the heart to the lungs to pick up oxygen. It forms most of the anterior surface of the heart. Because the heart is slightly twisted, it makes the anterior surface of the heart. Papillary muscles that I showed you before, papillae means finger-like, so they're finger-like muscle extensions, and they attach to the chordae tendineae and eventually to the valves. Chordae tendineae are cords between the valve cusps and papillary muscles. The interventricular septum, partitions the ventricles into left and right sides. The pulmonary semilunar valve, which we see up here, blood flows into the pulmonary trunk and then closes during ventricular diastole, which is relaxation. And this valve prevents blood coming from the pulmonary trunk back into the ventricle, and that helps maintain one-way flow of the blood. So this valve makes sure the blood does not go back into the atrium. This valve makes sure blood does not go back into the ventricle, maintaining flow from atrium to ventricle to trunk. Now we're to the left atrium. This is going to be receiving, excuse me, folks, I'm still getting over a little bit of a cold. This is going to be receiving oxygenated blood from the lungs. It forms most of the base of the heart, receives blood from the lungs via 4 pulmonary veins, 2 right and 2 left. You can see the 2 entrances here, but the other 2 are hidden. The bicuspid valve shown here has 2 cusps, hence the term bicuspid. To remember the names of this valve, they have several different names. And this may come up on the test. It may be all of these answers are correct, so be careful of that. It can be left atrioventricular, mitral, or bicuspid, giving you the mnemonic LAM. Left ventricle. This is the largest of the chambers of the heart, is going to be pumping oxygenated blood out to the entire body other than the lungs. It forms the apex of the heart. You can see the tip of the heart there is formed by it. Chordae tendineae anchor the bicuspid valve to the papillary muscles and has trabeculae carneae, which are little folds and wrinkles like the right ventricle. The aortic semilunar valve, which you see here, opens to allow blood leaving the left ventricle into the aortic arch, and then closes during ventricular diastole to prevent blood from going from the aorta back into the left ventricle. Now, if you ask the question, why is this the left but on my right? Remember, when you face someone, and this is the patient's heart, everything's reversed. So when you face someone, your right is their left and vice versa. Myocardial thickness and function. The thickness of the myocardium varies according to the function of the chamber. In general, atria have thinner myocardial walls and ventricles have thicker ones. Atria are thin walled, delivering blood to adjacent ventricles. Their only job is to contract and push a little bit more extra blood into the ventricles, allowing them to contract with more force and deliver more blood per ventricular systole. The ventricle walls, however, are thicker and stronger because they're not just pumping blood from one chamber to another, they're pumping blood away from the heart to the body. Now, what you'll see is that the right ventricle is going to be a little bit thinner walled than the left because it only has to supply the lungs, whereas the thickest wall is going to be on the left ventricle because it has to supply oxygenated blood to the rest of the entire body: head, shoulders, arms, abdomen, hips, and legs. Okay, so you can see here, left ventricular wall much thicker than right ventricular wall, and even both of those are thicker than the atrial walls. Okay, we're going to go through the sequence of events. AV valves, or atrioventricular valves, they close to prevent backflow of blood into the atria during ventricular diastole, which is relaxation. When the ventricles contract, this is the closure during ventricular contraction, pushing the cusps closed. This works very much like a parachute. So you can see what appears to be kind of like a parachute top and the cords that would be attached to the skydiver. Chordae tendineae are pulled taut, papillary muscles contract to pull the cords and prevent the cusps from everting. So in the same way that a parachute would catch air to slow a skydiver, these bicuspid and tricuspid valves catch blood to prevent it from going from the ventricle into the atrium. Okay, so if you make a particular cut through the base of the heart, you can see all the valves here. The AV valves open and allow blood to flow from the atria to ventricles when ventricular pressure is lower than atrial pressure. This would be during atrial systole, which is contraction, and ventricular diastole, which is relaxation. Okay, semilunar valves. As I told you, they open during ventricular contraction, allowing ventricular blood to leave through the large arteries of the heart. So the pulmonary trunk is the only one with the word trunk in it. The aorta is a trunk, but doesn't have that word in it. The semilunar valves close during ventricular relaxation, preventing blood from returning to the ventricles, again, ensuring one-way flow from atria to ventricle, ventricle to large artery, and then to the body. Okay, we're going to skip this for now. A little bit more about blood circulation. It is considered a closed circuit, and there's 2 of them. One is systemic and one is pulmonary. And I've mentioned these a little bit so far. In systemic circulation, the left side of the heart pumps blood throughout the body. This would be oxygenated blood. The left ventricle pumps oxygenated blood into the aorta. The aorta branches into many arteries that travel to organs, delivering oxygenated blood. The arteries branch into many arterioles within the tissue. And then the arterioles branch into thin-walled capillaries for exchange of gases and nutrients. This is the only place naturally that anything ever enters or leaves the blood. Now, if you were in a doctor's office or a hospital and they pierced your blood vessel, putting in an IV or a injection of some sort, that would be a place something could enter or exit the blood, but that's not naturally where it occurs. Naturally, nothing enters or leaves your blood except through the capillaries. Now, the blood is deoxygenated and it begins its return in venules back towards the heart. Venules merge into veins and return to the right atrium through both the superior and inferior vena cava. Okay, this is an image showing a super simplified version of how this all works. You can see the pulmonary system is sending deoxygenated blood out through the pulmonary arteries. Oxygenation occurs and pulmonary veins bring oxygenated blood back to the heart and then out through the aortic arch to the upper part of the body and lower part of the body. So the pulmonary circulation, the right side of the heart pumps deoxygenated blood to the lungs. Right ventricle pumps blood to the pulmonary trunk. We've gone over this, but here it is explicitly in your notes. Pulmonary trunk branches into the pulmonary arteries. Pulmonary arteries carry blood to the lungs for exchange of gases. And then oxygenated blood returns to the heart in pulmonary veins, as I've just described. Coronary circulation, we're talking about the circulation associated with the heart. Coronary circulation is blood supply to the heart. Heart is a very active muscle, needs lots of oxygen. When the heart relaxes, high pressure of blood in the aorta pushes the blood into the coronary vessels. There are many anastomoses. Now, what is an anastomosis? Anastomosis singular, anastomoses plural. They're connections between arteries supplying blood to the same region, providing alternate routes if one artery becomes occluded or blocked. This is especially important in the heart because if you have blockage of one, you need to still be able to deliver oxygenated blood to the heart muscle. When people need a bypass or stent, it's usually because several of these anastomoses or collateral circulatory pathways have been blocked. So this is showing you the coronary arteries. The grayed out means on the posterior surface. This is showing you, as I showed you in the very first slide, the venous system, the coronary supply. A conduction system, we're talking about the nervous system of the heart. There are autorhythmic cells, which means that they can contract without specific innervation from the nervous system. And they can act as a pacemaker and form the conduction system of the heart. The primary pacemaker of your heart, natural pacemaker. Now, we're not talking about a pacemaker that gets implanted. That's an external or artificial pacemaker. You have a pacemaker in your heart, and it's called the SA node, or sinoatrial node. It's a cluster of cells in the wall of the right atrium. It begins heart activity that spreads to both atria, so that allows the atria to beat first. Now, please note, both atria beat together, and then both ventricles beat together. It's not a left first and then right. Two atria beat, and then two ventricles beat. The excitation spreads to the atrioventricular node. The atrioventricular node is found in the atrial septum. It transmits some signal to the bundle of His, not his, but His. One of the jobs of the AV node, though, I should let you know, is to provide a little bit of a pause between the contraction of the atria and the contraction of the ventricles. Now, why is this significant? Because there needs to be time between the atria beginning to contract and their filling of the ventricles. And you don't want the ventricles to contract before they're fully filled. So the AV node providing that pause between atrial and ventricular contractions is important so that ventricles can fill fully, contract forcefully, and eject a large amount of blood to the body. So then you get the AV bundle of His. It's a connection between the atria and ventricles. It divides into the bundle branches, Purkinje fibers moving down through the interventricular septum, and large diameter fibers that conduct the signals quickly down towards the apex of the heart and then spread upward, allowing the ventricles to begin their contraction from the apex upward. Now, what's so significant about the ventricles starting their contraction at the apex rather than closer to the atria? Now, the reason why this is important is the same reason why you squeeze a tube of toothpaste from the bottom and not where the opening is. Because if you squeeze where the opening was, the bottom would blow out. You wouldn't get a good delivery of toothpaste. So because the blood is leaving up and out through the base, you want to start the contraction at the bottom of the heart, which is called the apex. And as it spreads upward, the blood gets pushed upward and outward through both the pulmonary trunk and the aorta, so that you get an effective contraction and an effective ejection of blood from the ventricles. So you can see here, this is how it's set up. The signal spreads down through the interventricular septum, and then the Purkinje fibers spread out through the ventricles, allowing the ventricles to start their contraction at the apex and upwards towards the base. And as what I just showed you or explained, this image shows you how that works. So take a look at it. If you have any questions, please let me know. Okay, heart sounds. You guys have heard of lub-dub or this a heart sound? Well, a stethoscope is what you use to hear those heart sounds. The sounds of the heartbeat are from turbulence in the blood flow caused by valve closure. Now, what you're hearing in heart sounds is not the beating of the heart, interestingly. It's the sound of the valves closing. In the same way that slamming a door in your house makes a lot of noise, closing valves makes noise. Because the AV valves are larger and under greater force, they're going to make the greater volume of noise. That's the lub sound. And then the dup is the second sound, is the sound of the semilunar valves closing under less pressure and with less force. Okay, heart is talking about heart disease, a little add-on here about pathology. What are some main risk factors in heart disease? Well, stress, high blood pressure, cigarette smoking, or even vaping because of the presence of the nicotine. And a big one, of course, obesity and lack of regular exercise. What can be some other factors that could increase your risk for heart disease? Diabetes, genetic predisposition, which there's nothing you can do anything about. But if you did know that heart disease ran in your family, you would want to be a little bit more careful getting checked out, making sure your weight was under control, getting plenty of exercise. High levels of fibrinogen in the blood can cause clots to happen, which can then block coronary arteries and therefore lead to a heart attack or coronary event. And left ventricular hypertrophy, which means an enlarged heart. Now, why is an enlarged heart a problem? Well, I'll explain it in more detail in physiology, but suffice it to say that having a large heart doesn't make it beat better, it makes it beat worse, because the same amount of blood isn't going to stretch the walls out as much. You're not going to get as much of a forceful contraction, and you're going to have problems moving the blood through the body. The details of this I will give you if you take my physiology class. Okay, as you know, sustained exercise increases oxygen demand in the muscles, but it also increases your body's ability to deliver oxygen, especially to the heart. So what are some benefits of exercise? These are them. Cardiac output increases, HDL, which is good high density lipoproteins, or what am I thinking of? It's evading me right now. Decreased triglycerides, which are fats, improved lung function, blood vessels start to grow in your lungs, decreased blood pressure, which is good on all your organs, and weight control. I'm going to remember this word when I am all done. Okay, that's it for today, folks. Appreciate you watching. Please send me any questions, and I hope to see you in my next live lecture. Bye, folks.